terms of the fact that what we have done is to prioritize and phase the implementation of the COVID-19 vaccination rollout. We are cognizant of the fact that there are hard-to-reach populations, there are border populations that are frequently left out in such endeavors, right? But right now, I'm sure you're aware of the fact that we are starting with the health workers, first responders, frontline workers, and people who are 50 years and above, those who are most susceptible. As we make progress into the subsequent phases, that is when we're going to be engaging with those hard-to-reach communities, and this is where our experience with the polio eradication program is going to be very, very critical in terms of all of the micro-planning that has gone into this vaccination process, the interpersonal communication, social mobilization. These are valuable lessons that we've learned from the polio eradication program, and we'll be replicating these during this COVID-19 vaccination. So as much as this appears to be a daunting task, we feel confident that the experience that we've garnered over the last 20, 30 years of the polio eradication program will come to bear. These are some of the huge lessons that we've learned that really strengthen our health system. Now, in terms of the challenges that we face in the COVID-19 vaccination program, one of the most important challenge, of course, is the unpredictability of the vaccine supply, right? So it's kind of hard for you to do very good and long-term planning if you don't have the vaccines at hand. Having said that, we recognize that without the efforts of the COVAX facility, the African Union, we probably will be without vaccines anyway, because we know in times past, because there hasn't been such a global solidarity towards making sure that all countries get vaccines equitably, we've seen that developing countries tend to be at the back end of long queues for the vaccines. But because of such collaborations led by the World Health Organization, UNICEF, CEPI, Gavi, we're able to have access to vaccines. So yes, the unpredictability of the vaccines makes it difficult for us to plan adequately. But again, we've learned so many lessons from previous campaigns that makes our planning very strategic and very nimble. So for example, we got about 4 million doses of the AstraZeneca vaccine. The initial communication was that within a month or so, we will get the second consignment of about 12 million doses of the vaccines. But as a result of the upsurge of the cases in India, India has stopped exporting vaccines. So we had to re-strategize. Instead of trying to give everybody, all the 4 million people, one dose, which will represent partial vaccination, we decided to halt or pause the vaccination process, make sure that only 2 million out of the original 4 million people will be vaccinated, so that instead of having 4 million partially vaccinated Nigerians, we will have 2 million completely fully vaccinated Nigerians, right? So we've had to, make changes as we go. And again, we've had incredible support from the Presidential Steering Committee, giving us all of the support that is required to make sure that we're able to communicate very clearly, working with the subnational level, working with the Nigeria Governors Forum, the Commissioners of Health, the Executive Secretaries of Health, to make sure that we're all working at the same pace, understanding exactly what needed to be done. Of course, there's also the issue of vaccine hesitancy, right? That is another challenge that we've seen. We've seen situations where viral videos go around in the social media that, carry the wrong information about vaccines. But we're not making these, issues that we're not able to deal with. We know that this is exactly why we're here as a Presidential Steering Committee, as the Federal Ministry of Health, NPHCDA, and the partnership, that we will continue to provide the correct information about COVID-19 vaccines, right? And then leave it to Nigerians to take that decision. Like we've said in the past, we believe that Nigerians are rational and that Nigerians will listen more to those whose core competence is around vaccination, public health, people who know more about vaccines rather than people who do not know the science but are making pronouncements that are not in their field of specialty, right? So it's a question of whether you want to listen to a doctor, an infectious disease specialist when it comes to vaccinations, or you want to listen to a very smart, say, geographer or somebody who is a historian or somebody else whose responsibility, whose core competence is not in the science. We have taken it up as our responsibility as scientists to provide information, and this is why we will continue to communicate. We're working with the Federal Ministry of Information, the National Orientation Agency, and other line ministries that are involved in this national effort to make sure that there's correct communication around COVID-19. We understand that even before the vaccines came to Nigeria, there was already negative information, making the airwaves. But we will not relent. We will continue to provide the correct information. And here we are, from a situation where most of the social media communications last year and the beginning of this year was like, oh, we're not going to take the COVID-19 vaccines. But, we've gotten close to 2 million people who have taken the vaccines. And the evidence is there that they are not falling like a pack of cards, right? The information that we got is that, oh, if you take the COVID-19 vaccines, you're going to become, you're going to turn into something else, or you are going to, all kinds of stories, right? But the information is there, not only from Nigeria, where we've vaccinated almost 2 million people and they are hale and hearty, but when you look globally, right? Over 100 million doses of the vaccines, different vaccines have been given to people, and these people are going around, very well and being protected against COVID-19 vaccine.
Nobody is safe until everybody is safe. No variant can be contained until all variants are contained wherever they are. We cannot underestimate the steps that have been taken, but also the challenges ahead of us. What has significantly taken place is, with the first doses, is that for a majority of frontline staff, especially the health staff, they have been protected with the first dose. As the Executive Director has said, the second dose vaccine has already started, and in many of states it will continue over the next 5 to 6 weeks. I want to thank, at this stage, the COVAX facility. That's the Gavi, CEPI, WHO and UNICEF for facilitating these vaccines, but to encourage that we provide the next round of vaccines as soon as it's possible, and as soon as the vaccines we have currently have been fully used up. I also want to thank the donors who are behind that, especially the EU, the USAID, FCDO, the Japanese government and others who have made sure that these vaccines are available and the resources are available to us. But today I think we need to also thank the Steering Committee on COVID-19 for their diligent stewardship of the COVID-19 pandemic, the Executive Director of the MPCDHA for his leadership in ensuring that all Nigerians are vaccinated against COVID over the next 2 years. But I want to encourage all governors, traditional leaders and religious leaders and community leaders to encourage their people to step forward and be vaccinated. Protecting yourself is important, but by doing so you also protect your family and you protect your communities. As the ED has said, We hope that by the end of this year that we will be able to vaccinate 40 million people, and then in 2022 the remaining 60 million that make up the 112 million that is our objective. But to do that, it requires a level of social mobilization which is unparalleled in our recent history. And everyone needs to come together to protect this great nation and its great people.